Hello and welcome to the Glen Merzer Show. Thank you for joining us. You can find us on YouTube and across all your favorite podcast platforms. Our special guest today is Dr. Richmond McCarty of Tupelo, Mississippi. That's where Elvis is from. He is a graduate of Kansas City University Osteopathic School of Medicine. He did 3 years of active duty as a flight surgeon. He's also certified in acupuncture. He's certified in lifestyle medicine. He's looking to open a lifestyle medicine clinic. He does something called Walk with a Doc, which we're going to talk to him about. Dr. Rich, thank you for joining us.
Glenn, thanks for having me on the show. I feel honored to be on your show, and I appreciate all the good work you do.
Well, I'm honored by your honor. Thank you, Dr. Rich. Tell us about this background. You started studying medicine in the middle of the country, Kansas City, and somewhere along the line you got interested in acupuncture and lifestyle medicine. How did that happen?
Well, I would say, Glenn, I've always been interested in multiple different modalities. And I think one of the things that drew me to osteopathic medicine versus allopathic medicine is the fact that osteopathic medicine takes more of a whole body approach. So some call it holistic. I don't know if I would use that word, but really it looks at the whole body. So whereas allopathic medicine really uses more treatment modalities to diagnose and treat illnesses, I kind of look at osteopathic medicine, looks at the whole body on how it's put together and really dissects it down from the musculoskeletal system to the nervous system to the metabolic system. So I just felt that was the better fit for me because I actually have an older brother who went the allopathic medicine route. So we have one allopathic medicine or MD, and then of course I went the osteopathic medicine route, which is a DO.
Well, let's say somebody goes to a doctor because he's got pneumonia. Would the DO treat him any differently than the allopathic doc?
Depends on the physician, Glenn. So I would say you can go down a path and you can be a osteopathic medicine and still practice more traditional medicine. I think, more than anything, obviously, the way I try to look at things is, yes, if someone came in with me and we diagnosed them with pneumonia, we would want to go ahead and treat the pneumonia, but then we would want to look at their risk factors. What put them at risk, Glenn? What can they do to prevent or reduce their risk moving forward, both environmentally, physically, and metabolically, Glenn?
So fair to say that you're looking more for the cause and to prevent a recurrence, and the standard Western doctors are looking more just at the treatment and the medicines?
Glenn, that's the only way I know how to practice is look for the root cause.
Right.
That is. I think that should be first and foremost in any physician's handbook. Unfortunately, that is not shared by everyone.
Now, I'm guessing that that's what led you to a concern over diet and nutrition, that perspective on health. Fair to say?
Fair to say. Fair to say. I think
Yeah.
one thing. Go ahead, Glenn.
Well, what specifically led you to the plant-based diet and to this approach to practicing medicine?
Well, obviously, with any type of medicine, whether it's osteopathic or allopathic, you're going to get traditional teachings. I mean, both have traditional teachings. So I think as I progressed in my training, I started to think there's got to be more to it than this. There's got to be better pathways to treat the patient because a lot of even, some of my professors would really just treat the end symptoms. And that just didn't seem right to me. So thankfully, I have that curiosity gene. And so I looked
Uh-huh.
outside that, and I think probably like everybody has that book they read, the documentary that they saw. And the first book I read was The China Study by Colin Campbell.
Right.
And that is, as you know, a landmark study, and he has been a pioneer in that. So that was the tip of the iceberg for me, and I was hooked after that. And so during my residency training, from there, I read Eat to Live by Joel Furman, and then book after book. And then I started to integrate those same principles into my practice. And I would encourage, my colleagues around me as well. I tried to practice what I preach and, push that message and open their eyes to really so much more out there than what we're taught. Because if you look at it, unfortunately, our current medical model is basically to keep people chronically sick, because the pharmaceutical industry, the medical industry makes billions of dollars chronically keeping people sick, and I couldn't go along with that. So
Well, the situation basically is that many people, most people who are sick are eating their way into disease. And as long as they keep eating the same foods, all the medicine can do is usually try to sustain them in their sickness. Is that fair to say?
I think that's fair to say, and I would also probably go so far to say is just prolong it.
Hmm.
And that's really what you see happening, because I would say, Glenn, I would say 70% of what I see on a daily basis in my practice could be treated simply with dietary and lifestyle interventions.
Right.
Um, and so, but, the current medical industry can't make money off that. So they're not interested in those types of things. So it's really, it's, you're having to change a whole culture. And, with where I practice in Mississippi, obviously we rank number one in all the things you don't want to rank number one in. So I would say, in one sense, I probably have a good job security. But, there's also a lot of opportunity. And so, really, I think I'm glad I'm where I am. I'm glad I've done what I've done so far, because I think there's a lot of opportunity in this state to really start to move people in a different direction. And there are a lot of resources out there, Glenn, just like, as you well know, when you start going down certain pathways, and, I've been plant-based for over 15 years, you really make a network over time. And so through that, I've been able to make, connections in the local area. From, we have a local organic CSA in our own town, which is surprising to be where we are. And we have other people who share that same passion. And I think there is a hunger for it, Glenn. I think people can be skeptical, and I think people can write situations off, but inherently, my experience is most patients who walk through my door, Glenn, want to get better. A lot of them just don't
Right.
know how. Yeah.
Well, let's go back to that day 15 years ago or so after you've read T. Colin Campbell's The China
Mhm.
Study. And what happens? You say to your wife, you know what? I'm not eating meat anymore. I don't think you should. How did it go down?
Well, I think it was, I would say it was a little more gradual transition. Obviously, you know, where I went to medical school, Kansas is, one of the beef capitals of the world.
Right.
But I have a great loving wife. She was supportive of that. And so we made that transition. And the interesting thing is I would say that first year I went 100% vegan, and
Okay.
I was very disciplined and strict. And then on my birthday, my wife said, "Let me cook you a small little fillet." And I said, "No, I don't. I think that's a terrible idea." And she was like, "Well, just let me do it." It's been a long time. And I said, I don't think that's a good idea. But anyway, I submitted because she's my wife.
Uh-huh.
And that was probably the worst night of my life, Glenn. My
Really?
body, my body rejected that. And I really didn't eat
Uh-huh.
that much, but it had been so long since I had had any type of
Uh-huh.
animal product. It was a bit surprising to me as well, but it was a very good lesson.
Well, I
Uh,
hope your wife learned that lesson too.
she did. She did. She
Now,
did.
what about her diet? Did she transform along with you?
She has. I mean, she is not percentage wise. I mean, she still will consume probably, I would say, Glenn, 20% some animal based products. And,
Hmm.
my goal here is, and same with, we have three boys. And I say boys, and they're starting to become men,
Right.
ages 20, 18, and 13. And really what I try to do is I try to lead by example. I try to educate them. And as you probably well know, anytime you try to force something on children or loved ones, it doesn't go well. So, again, I do my best to educate. And I will say, as a result, they are much healthier than I was at their age. And
Okay.
they're and I think health is very much on their radar. So I would call that a win for right now.
Now, how about your professional colleagues? Do they think you're wacky or have they been influenced by you?
I would probably say a little bit of both.
Okay.
Uh, right. So I think I have several colleagues. In fact, I have one or two that have gone completely plant based off my influence and their own desire to live a healthier lifestyle. So that has been very encouraging. And I will say that people are open to it. I think people are hungry for it. In fact, I gave a recent lifestyle medicine lecture at our local cardiology conference. And I was the only non-cardiologist that gave a lecture. And interesting
Hmm.
enough, it seemed after my lecture, I probably had the most engagement and questions, at least the day I gave the lecture, because I think people are hungry for that, Glenn. And I think one of the ways you present it is if you look at our current medical model and you look at our current setup, when you look at from a technology standpoint, we're more advanced than we've ever been, Glenn. When you look at the procedures we can do, the robotic surgeries, you look at some of the newer medicines coming out and their mechanism of action, it's pretty amazing. However, we're sicker than we've ever been, Glenn. And the epidemic, the chronic disease, the obesity continues to expand at a linear rate, yet we're more advanced than we've ever been. So obviously we're missing the point.
It's
Uh,
so obvious. You say obviously. It's so obvious that I'm just amazed that we still have to be in the minority here trying to convince the majority that they're doing something wrong. I mean, the level we're talking about 42% obesity in the United States of America, and I'm guessing it's probably closer to 50% in Mississippi, right?
I think Mississippi's number one, Glenn, both
Yeah.
in obesity and interesting enough, they're number one in lack of exercise. So not only are we the most obese state, we get the least amount of exercise per the CDC statistics. So again, we can look at that one or two ways, Glenn. You can look at it as that's kind of a tragedy in one sense, but at the same time, it's a great opportunity to be engaged and really push that message because I think it's a message that people want to hear, and I think people are hungry for it, and I think people underestimate. People are tired of being sick, Glenn. People are tired of going to the doctor and getting a medication for something that can be reversed through lifestyle and diet, but they just don't know how.
Right. There's that old Chinese thing about crisis equals opportunity,
Mhm.
and that's what's going on.
It is very
Um,
much so.
how about your patients? When you sit down with an obese patient with type 2 diabetes and you explain to him or her that it's the way they're eating that's causing the problems, are they open to it? Have you transformed any of your patients into vegans?
I've definitely yes, to answer your question, that would be yes.
Uh-huh.
And I think, the conversation I start when I have a either newly diagnosed diabetic or a new patient who's a diabetic, first
Mhm.
I kind of confront them and say, you do realize the majority of this can be reversed, because that's one thing they've never been told, Glenn. Most doctors say once you're diagnosed as a diabetic, you're a diabetic forever. And so you are at high risk. Don't get me wrong. You can reverse your diabetes, or what we now say, put it in remission, but you are higher risk to go back if you were to stray back to your old ways. But I think the tragedy is most of those patients, Glenn, don't realize they can reverse it as a chronic disease. And so
Well,
that's
what
the first.
happens when you tell them that they can?
Then they're open. They're definitely open for that. And so
And
that's
do you
encouraged.
say to them, look, you can reverse this, but it means you have to stop eating meat and stop eating dairy and start eating a human diet of fruits, vegetables, whole grains, legumes? Do they are they open to that?
I would say it's baby steps. And now I would say some patients, Glenn, seek me out, and they seek me out specifically because how I practice medicine. So they are very open. So I've had two recent patients who underwent cardiac catheterization, received stents, and they were not happy with their follow-up visits and the treatment regimen they were given, because they were basically had a stent put in them, given some medicine, and then they, ask what else they could do. And they basically said, that's about it. And so, wow. So they sought me out, and both these recent ones have gone completely plant-based, Glenn,
Yeah,
and remarkable, response on their lipid panels, their just
yeah,
quality of life, their blood pressure, their weight went back to baseline. And I mean, they're sold. You don't
yeah.
have to. Once that happens, your mission is accomplished outside of, adjusting small things and continue to give them guidance and encouragement. But it's
Right.
it's it's a great thing to watch, and I don't think I could continue to practice medicine if I couldn't do those things.
Yeah. I
Yeah.
mean, I find that it works just about 100% of the time. That if people are overweight or obese, uh, either have type 2 diabetes or pre diabetic, suffering from a whole range of metabolic disorders, if they eat the way you and I eat, they get better like
They do.
100% of the time.
Well, I would say 100% of the time, you're going to see significant clinical improvement, without a
Right.
doubt, without a
Yeah.
doubt. And
And
and again,
yet, most doctors either don't know the information or they don't think that their patients can do it. What do you think it is?
I think it's a
Because
combination.
frankly, I find it to be stunning, that they don't study nutrition in medical school. Doctors,
They don't.
most doctors do not practice the way you practice. Most doctors do not talk to their patients about diet. What do they think is making their patients fat and sick, if not what they're eating?
Well,
Do you find it as stunning as I find it?
I would say that I think most times I think it's multifactorial. One is some doctors just don't know. They really don't know, Glenn, and they have followed, like a good student, the traditional teachings, and they have bought into that, and they think that's the proper way to treat. So in one sense, that's one of the big hurdles we've got to get over. We've got to integrate more teachings from a lifestyle medicine standpoint when you're training doctors. That needs to be part of the core curriculum, Glenn.
Mm-hmm.
And it's not that the data isn't there. There are plenty of studies to support this approach. I think the other thing you look at, some physicians, and this just isn't physicians, this isn't any career path, are content, Glenn. They're content with what they do. They're not going to go outside of their space. And, for the most part, that's good enough for them. And I think that exists in any career path.
Well, I think that last point is very insightful, because I think for many doctors, they're eating the standard American diet themselves. Some
Correct.
of them are overweight,
Correct.
but they are pillars of their communities.
They are.
They earn a very good living. They're looked up to. Why rock the boat and tell everybody that they need to be on a plant-based diet? It just isn't in most of them to want to rock the boat.
Exactly. So, and I would say the other thing, Glenn, is our current medical system is not set up to really support or reimburse that. So the way I look at it is the physician should get paid more if you get that patient off insulin. You get that patient off insulin, you just saved that insurance company $1,000 a month minimum. So you get them off insulin, you get them off, some of these different high-priced oral diabetic medications. Because if you look at most health organizations, Glenn, when you look at the pharmacy cost, diabetes medications accounts for 60 to 70% of the cost of their pharmacy total cost. I mean, it's amazing what those medications cost. So you've got, I'm sure you've heard about the miracle weight loss drug Ozempic. That is heavily coveted from the common housewife who does not have diabetes but desperately wants to lose weight but doesn't want to do the things that needs to be done, to the overweight diabetic who will definitely benefit from that if you utilize other lifestyle measures and take that opportunity. And that's what I try to tell my patients, is that this is an opportunity to also change all the habits that got you to where you are. So I'm not against using medication, don't get me wrong, because not every patient is going to be as open as you or I are to those lifestyle changes. But sometimes you just have to take what they give. And as you make progress, what you see is they become more and more open to those changes. And that's what the goal is for any patient, to improve their overall state of health. And to think that we're going to change every patient into a fully whole food plant-based diet, that little bit wishful thinking. But I think
that's a specialty of mine.
I
the wishful
understand.
thinking.
I understand. And I think we definitely need people like you, Glenn. We definitely need people like you. So I think that, in my opinion, if we could get a baseline and really integrate that plant-based nutrition in every medical school across the nation and use that as frontline therapy, because lifestyle intervention should be frontline therapy for every patient, bar none. And, we know we have that small percentage of people who aren't going to, adhere to some of that. But I would say 9 times out of 10, people are willing to make changes if they can see the value in it, Glenn. But, just like this conversation, when you look at medicine and the way it's practiced, we are moving more toward what's called value-based care, where you are basically paid or reimbursed for the value you provide that patient, the quality of care. But currently, it's still somewhat fee for service. So that means, Glenn, the more people I see, the more money I make, which means if you actually want to take time with your patients and educate them, you're going to, in theory, in that model, lose money.
Right.
Right.
Yeah. You say that it's moving towards value-based compensation. In what way?
Well, that's how the insurances are moving toward reimbursing both health systems and physicians. So basically, some of that is cost saving. So you can say, let's say you're caring for 100 of these participants of this particular insurance, and they allot $1,000 per participant, and you hit all the criteria of what they call quality-based care, but you do it for $800, then there's a cost saving between the insurance and the system. So basically, you would split what you saved.
Well, wait a minute there. So that's the insurance company rewarding you for saving money, but do they reward you for getting the 100 obese patients to not be obese?
It's going to be slow, Glenn. It's going to be slow.
That's
So,
not what they're rewarding you for, huh?
well, I would say they're moving towards. So really, right now, when you look at quality-based care, you're looking at colonoscopies,
Uh-huh.
mammograms, pneumonia shots. So I think there is positive. That is a positive direction. Now, is it the direction that you and I want it to be? Not quite.
Mhm.
But
Yeah.
again, big things move very slowly.
Right.
Yeah.
All right. Well, let's talk colonoscopy since you raised the subject.
Sure.
That's always an interesting thing to talk about. I confess I've never had the pleasure of
Okay.
having a colonoscopy. Now, I'm getting old enough now that it has been recommended to me for a couple decades to have one. And every year, I like to visit my doctor once a year for an annual checkup to see how he's feeling.
Sure.
And every year it's recommended to me, and every year I make an excuse. And here's my reasoning. And everybody out there, I'm not a doctor. Don't listen to me. I'm just giving my uneducated opinion. Please listen to Dr. Rich, not to me. But here's my thinking on it. There are some risks associated with colonoscopy. They are slim. But every so often, somebody's colon gets perforated.
Correct.
So every so often, there's a downside.
There is.
And there are statistics on it. There have been a lot of studies on it.
Right.
And I think they've probably proven beyond the shadow of a doubt that for the average American, there's some benefit to getting a colonoscopy. But I'm not the average American.
Correct.
I'm not eating what they're eating. There are no studies, correct me if I'm wrong, but I think there are no studies of whether somebody on a low-fat, whole food, plant-based diet benefits from a colonoscopy in relation to the risks. So that's why I haven't done it, because I don't see any science out there telling me that I should do it.
Well,
Your reaction to that?
I think it's case by case in one sense. So I would say with where I practice with a higher risk population. So when you
Sure.
look at the majority of these patients who follow the standard American diet, and of course there are other risk factors. African Americans tend to have a higher incidence. Obviously, there's a direct link to processed meats and colorectal cancer.
Sure.
So 2 pieces of bacon a day, it doesn't take much.
Oh,
Now,
yeah, I would recommend it for anybody eating that way.
so I would, you can draw the analogy, and some of this you can pull from, well, there are a couple things you can pull it from, but actually, the China study is going to show one, and then John Robinson, Healthy at 100, had some good kind of good data too. But so what you're really referring to is you follow a high fiber, and we
That's
know,
right.
right? So we know high fiber diets actually reduce your risk,
Of course.
definitely over time, and you're not putting foods in that increase your risk.
That's
Um,
right.
Also, you're staying within a normal BMI. So what I would say to you is you are definitely low risk with the way you practice. Now, I think you're not no risk, and
Right.
if you didn't have a family history, so if there's no family history, I mean, I would say the odds are in your favor that it is highly unlikely you will go on to develop it.
Right.
If you draw some of those analogies, so I wouldn't argue too hard with you on
Yeah.
that one. So,
Yeah. And,
yeah,
I have a general philosophy, which is if I'm having a problem and it doesn't go away and it's bothersome, I go to the doctor. And I also check on my blood work from time to time. And last time I discovered I was a little low on vitamin D, so I'm taking vitamin D supplements. Um, but if I don't have a problem, I don't go looking for problems. And I'm scared of tests that find things that sometimes you're not looking for. I'll give you another example. I once had 104 fever. So I went to the doctor. 104 is pretty high.
it is.
And he did what was probably right. I am not criticizing him. He said I should have a chest x ray to rule out pneumonia, I think was the reasoning. Now,
Correct.
I think, correct me if I'm wrong, that's probably standard of care, right? A reasonable thing for him to say?
That would be, so I would say that would be reasonable. If I would probably screen you for certain things. If this was kind of the flu season, screen you for flu, probably
Right,
get a baseline blood count. And
right,
depending on that, then I would say, yes, a chest x-ray would be appropriate if there was no obvious etiology to your fever.
right. Well, I um, I wouldn't object at any time to a blood test, but I didn't want the chest X-ray. And he
Okay.
said, "Why not?" And I said, "Because you're going to tell me that I have a nodule on my thyroid, or a dark spot in my lung. You're going to make me miserable. I don't want to know it." He said, "But if you had a dark spot in your lung, wouldn't you want to know about it?" I said, "Of course not. Why would I want to know about it? I don't go looking for things. I'm feeling fine, except I got 104 fever. So could I please have an antibiotic? You know, and that's my attitude. I just do not want to test for things if I'm not having a problem. I have 104 fever. I need to go to the doctor, but I do not want to do unnecessary testing."
I understand. And I would
Yeah,
say there is a lot of unnecessary testing that does
yeah,
exist out there. So I think it's important, like anything, Glenn, is that communication aspect between the patient and the doctor is key. And the better the communication, the more comfortable you are as the patient to understand the value of that chest x-ray and what it will do for
yeah.
you and what it won't.
Right,
And I think it's important as the physician to respect your your position, but also to be very educational to say that's fine. But if I give you an antibiotic in that scenario, we don't quite know what we're treating. Yes, you do have a fever; it
right.
could be bacteria. So right. So I agree with that.
Yeah.
Yeah.
I just think that, you know, very few doctors are encouraging their patients to engage in healthy habits with their diet. And too many doctors are willing to test to the limits. And so what you have is an unhealthy population that is worried about all kinds of nodules on their thyroid and all kinds of things that maybe they're better off not knowing about, but what they should be focused on is eating healthy.
Well, the
Now
focus is
you
in the right area, right?
you were a flight surgeon in the Air
Correct.
Force.
I was.
Now, tell me about being a flight surgeon. I'm guessing that doesn't mean you were doing tonsillectomies in the cockpit. What does it mean to be a flight surgeon?
Well, I think in the old, maybe that would have voted to be true. But in this day and age, no. So a flight surgeon is essentially attached to a squadron, and they basically provide medical support from a aerospace medicine. So I had to go through some additional training as a physician in aerospace medicine. So I think any full-blooded guy who enjoys, activity, exercise, sports, this was a great fit for me. So I
Uh-huh.
got to basically go through a modified version of pilot, training, and so you get to kind of experience what they experience, because if you don't, how do you know what they're experiencing? So that was a really neat thing. So basically, you're attached to the squadron, and then you deploy wherever the squadron goes and continue to provide medical support. And that's kind of the general role of the flight surgeon. And with where I was stationed at what's called Beale Air Force Base, which is in Northern California. The mission of that base is reconnaissance, and they have, at the time, they still flew what's called the U-2, and that's the one where Gary Powers got shot down.
Yeah, that was
Right.
that spy
Yeah.
plane, wasn't it?
Right.
Yeah.
So that's, just from, a medicine physiology standpoint, they wear what's called a complete pressure suit. And so basically a spacesuit, and they're flying 70,000 plus in altitude. So it's a neat setup.
Did you learn to fly along the way?
So that would have been grand. I think if I had not been married with two young children,
Uh-huh.
I could have gotten my pilot license, but I don't know if my wife would have loved me as much
Uh-huh.
if I had been gone any more than I was. So now I will say, with the pilots that I became close with, once we got up in the air, they were happy to turn over the stick. I just wasn't
Uh-huh.
landing or taking off, so that was
Okay.
kind of fun.
So you
So
were like a little kid who's with daddy in the car with the steering wheel.
basically.
Yeah.
And that
Okay.
was, you got a lot of neat opportunities in that aspect. So it
All
was
right.
it was
Do
a
you
great
did
learn.
you enjoy flying?
Oh, loved it.
Yeah.
So it was a great experience, and I would do it in a heartbeat again. So
All right. Now, where did the interest in acupuncture come in?
I think I always had an interest. There was, and I'm gonna forget his name, but it was. I might be incorrect. I want to say it may have been even back far as in the Roosevelt era, but there was a high end, um, basically government diplomat who was over. I want to say in Japan, when I want to say he had ended up having an appendectomy. And what happened is during that course of treatment, they use acupuncture for a lot of post-op pain. He had what's called a post-op ileus. They use acupuncture to treat that. And I was fascinated by that. And so obviously, when I'm fascinated by something, just like plant-based medicine, I dive in. And when I dove in, I was like, this is something I've got to do. And so I looked, and I found a physician based course. And I was able to do that my third year in residency. So I completed my acupuncture course while I completed my last year of residency.
And
And it was,
how often have you used it in your role as a doctor?
so I would say probably, Glenn, my first 7 years of practice, I had a dedicated half day where all I did was
Really?
acupuncture. Yeah. And so,
Really?
when we designed
Within what kind of medical setting?
a clinic setting, so a
So
kind of a
within a standard Western clinic, you were practicing acupuncture?
yes,
That's unusual, isn't it, in Mississippi?
very unusual.
And
Very.
did you get a lot of funny looks?
I, I think I got a lot of raised eyebrows.
Okay.
But again, like anything, there is when you bring something of value to any area, there's going to be a market, there's going to be a demand, and if you're doing it for the right reasons, there always is. So that was a great experience. I remember I was probably in practice for, I bet I'd been there 2 weeks. I had a older gentleman come in who had the hiccups for 2 weeks
Huh.
straight, Glenn.
Oh my God, that's a nightmare.
And he had seen multiple physicians, and he was, I really think he was about to lose his mind. And so I said, look, I said, let's try this acupuncture treatment. We did it. He called me the next day and said, if I was there, I would hug you, because my hiccups are gone. Now,
Wow.
could have been coincidental. It's possible.
Uh-huh.
But there's definitely value in that. And so,
Now, is there a spot that you're supposed to hit with the needles when somebody has the hiccups? How do you know where to poke them?
well, so just like most things, there are different protocols.
Uh-huh.
And in one interesting thing, there's a protocol called battlefield acupuncture. And so battlefield acupuncture was actually developed, as you would think, in the kind of military setting. There was a colonel in the Air Force who did pre and post MRIs on points, acupuncture points that help control pain. And so what they would do is they would do the treatment and then do a post MRI. And what you would see is a lot of those areas in the brain that light up because of pain would have significantly gone down. And so they implemented this in practice. So medics would go in, and it was an ear protocol. So they would put, basically, it's five little metal studs essentially that you put in, and they had great results. So it's fascinating. And if I had an ideal world, Glenn, I would go over, to Japan or China and study for a year, just because I'm
Hmm.
so fascinated by it. Because, if you read the literature, in the more rural areas, they will actually use acupuncture for mild anesthesia to do simple procedures. Uh,
Interesting that you say that because a few years ago I went for acupuncture just for some mild leg pain I was having, and the woman acupuncturist put the needles all over my body, and then she said, "Now rest here for 20 minutes, and I'll be back." And I think the lights were out or very low. And every single session, when she left me alone for 20 minutes, I fell asleep. There was something about having those needles in my body that just put me to sleep. Is that an unusual
no,
reaction?
not at all. Not at all.
Hmm.
It's not unusual at all. And that's about what I would do with treatments. And then, of course, I would do a lot of what they call PINS treatments, or peripheral electrical nerve stimulation. So, kind of, if you've ever heard of a TENS unit, they use a TENS unit a lot, even with physical therapy, but actually you can hook that up to the needles and conduct mild electricity, for different types of treatment. And then you can use heat. You can use what's called moxa, which is the funny smelling stuff. Now that drew some very high eyebrows, because
Uh-huh.
moxa smells similar to some illegal illegal things people like to
How
smoke.
do you spell this word?
Moxa,
Yeah. It sounds
Uh,
like the Jewish bread.
I don't think it's spelled the same way. If I remember correctly, Glenn, it's Moxa, Moxa.
Oh, Moxx? Okay. It
Moxa.
sounded like unleavened bread.
Okay. Yeah. So,
Um, and so is acupuncture a good treatment for a way to either avoid pain or overcome pain?
oh, without a doubt, it's a
Yeah.
great treatment
A,
modality
a
because
post-operative procedure.
yes, you could do. Yep,
Yeah.
definitely. So I think um, you know they the way acupuncture looks at things, they have what's called principal meridians. So think of those as
Mhm.
energy highways throughout your body. And so when they look at problems, they really look at it one of three ways. There is basically a barrier that you have to overcome. There is a deficit that you have to basically replace, or there's an excess that you have to get rid of. And so that's
Mhm.
essentially how they look at things. And then you recreate a balance.
Okay. Tell us about Walk with a Doc. What is this program? Did you start this program in your town?
I did. So it was a challenge because I was able to get some funding for that, kind of through a grant, and it was a cardiologist who started this. And so basically, it started with him saying, had a couple of his patients meet him at the park and said, "Let's go for
Hmm.
a walk." And from that evolved Walk with the Doc. And while he was there, he would talk with them about different topics, about health, about different lifestyle and dietary interventions that you could do to improve your overall quality of health. And as that kind of blossomed, he was like, "Well, this would be a great program." And so that
Right.
Walk with the Doc evolved. And so we have a nurse practitioner fellowship program through our hospital. And I brought that in, and that's one thing they kind of help champion to bring people. And we have a local hospital track. And so we would meet, and somebody would give a little small lecture at the beginning, and then everybody would walk, and you could come up to, whether any type of medical provider and have a conversation and ask questions. And it was very casual, which was very nice.
Well, it seems to me a beautiful thing to do for the community because it's a way for people to get to know their doctors, spend time with their doctors, actually get some exercise with their doctors. And I imagine what happens is sometimes they sidle over to you and say, "Hey, what should I do about this? I'm having some pain in my shoulder or whatever." And they get some free consultation, right?
Exactly.
Yeah.
And like you said, it fosters that good relationship, and that's key to, I think, helping people move in the right direction. So
Yeah.
yeah.
So, how many doctors are participating in Tupelo in Walk with a Doc?
I would not say a high percentage. I would
Is it
like
just
to
a handful of you?
just a handful. That's correct.
Okay.
So
And how many? So, on a typical, is it an afternoon or early evening when you go walking?
it's typically a afternoon, maybe kind of like a after lunchtime. Usually it
Okay.
lasts up to an hour. And so, you'll get anywhere from maybe 30 to 40 people that show up.
Really, 30 to 40 people come
Hmm. Hmm.
with two or three doctors, maybe.
Right, right.
Yeah.
So it's good. It's
Well, that's a
another
great program. That ought to
it's
be a
another
national program.
it should. I agree.
And now you have ambitious plans to start a lifestyle medicine clinic in Tupelo, Mississippi, right?
That's correct. We
So
are
what do you envision this clinic? What do you think it'll be like? How will it differ from most clinics?
So this clinic, Glenn, is going to be more of a team-based approach. And so what that basically means is you're going to work with a team to improve your overall state of health. So what you'll do is you'll meet with me as the physician, from a lifestyle medicine standpoint and from a metabolic standpoint. Then you'll meet with the dietitian, who's going to be plant-centered, plant-based dietitian. You'll meet with the exercise physiologist, because exercise is a key component to both, acute and long-term health. And then you'll have a screening by a physical therapist to look for any major functional deficits that may prevent you from doing that. So,
All right.
yeah.
And you hope that this will exist starting when?
The hope right now, Glenn, is that we're projecting the first of the year. So January of 2024 is the current projection. But like anything, I won't hold my breath. But we
Okay.
will continue to be optimistic and positive, and work in that direction. But so far, we kind of have great support. I think there are a lot of people behind it. I think timing is good timing at this point. And again, we'll hope for the best and, keep pushing.
So once that happens, that'll be your workplace. That'll be where you're working as a doctor full time, right?
So we'll slowly evolve that, Glenn, because that's a new design, new model. And so I'll start off there, Glenn, 1 day a week. And
Oh,
so we'll
only one day a week.
right. Well, so that's one of those things that you kind of have to grow.
Okay.
Um, And so, not everybody's looking for that. I wish everybody was, and I wish that was the
Hmm.
design. But you, just like anything, we have what we want, but we also have to have realistic expectations.
Right.
So that's key too.
So,
But like anything of value, kind of like the field of dreams, if you build it, hopefully they will come. So
right. So it's a function of patient demand. If the patients demand it, you'll be spending more time there.
correct, correct.
So let me say to the people of Tupelo, Mississippi who are listening, when that clinic is up, that's where you want to go. You want to go to the lifestyle medicine clinic to get healthy instead of just getting medicines and staying sick.
Exactly.
It's really that simple and that obvious, isn't it? That people need to treat the causes of disease rather than just treating the symptoms.
It's that simple, Glenn. It really is.
Yeah,
Yeah.
yeah. And do you find, Dr. Rich, that you're winning over your colleagues one by one?
I think that I've been at it long enough that I think people know I'm passionate about it. And I think
Yeah.
that as things evolve, and I would say, just like the American College of Lifestyle Medicine, you're seeing these things pop up over time and promoting that. And more importantly, Glenn, that the empirical data is there. It's not a
Yeah.
question of, hey, they're those kind of wonky, crazy vegans who, eat grass and berries and, are trying to save animals. I mean, this is a science. And I think that's partly how you win over some of this population, is that, this isn't the 60s or 70s anymore. I've got hard data to show you that. Why wouldn't you be doing this? Why would you still be, recommending a low fat diet or a, high protein diet, in the sense that this is what that's going to do? So, there's just not a question anymore. And, I think that's another avenue we approach, because people, I think most physicians will listen to reason when you've got data to back it up. And not everybody, but I think
Mhm.
most physicians will. And so you just have to kind of buy into it. So
Well, Dr. Richmond McCarty, thank you for doing the good work you do in the underserved state of Mississippi. Thank you for joining us today. And keep up the good fight for good health. And thank you all for listening. Please remember to subscribe. We're trying to get to 2 million subscribers, so we're a little shy of that right now, but please subscribe and we'll get there. Thank you again. Thank you, Dr. Rich, for joining us.
And Glenn, thanks for providing a good platform to pass on that message.
All right.
All right.